Okay, so now we move to the dermatological section and we have a new mnemonic, and that is rip and help. And that means rash, itch, patch, and then you're also going to take history about nails, hair, lump, and pigmentation. So now let's dive into the scene and make a typical presentation of help and rip. Yes. What else can be a good place to call for help besides this graveyard where you have the reaper or just the dead man standing beside you? Now, as you can see, there's someone calling for help through the grave, while the reaper stands beside. Now, as a rule of thumb, first things first. So we're going to discuss itch first, and we're going to represent it by an itchy dog. Now, itching is also known as pruritus, and it has multiple causes. Sometimes this itching is with visible skin lesions, while the other times this itching is without visible skin lesions. And in that case, you're going to say that itch is secondary to some systemic disease. And third, we can have psychosomatic causes. First of all, we're going to talk about the itch with a visible skin lesion. So in this type, it's going to include allergic conditions, for example, urticaria, contact dermatitis, or just insect bite. Now we'll draw a wheel beside this itchy dog. This wheel is going to tell you about wheals, which can be with or without puffiness of lips or eyelids. And these wheals are seen in urticaria. Next, we'll draw some green glowing light that suspiciously looks like antibodies. Oh, yes, of course, it's an antibody. And these antibodies are seen in allergic reaction, for example, contact dermatitis, insect bites, and urticaria. So if there comes a patient with itching, must rule out these allergic conditions. Now, what's more next? We draw two bears, and one of the bear is polar bear, and the other is just a standard bear. Now, the polar bear belongs to a very cold environment, and the standard bear belongs to a very hot environment. So, you're going to ask about the frostbite or prickly heat sunburn. Also, you're going to notice that there are a lot of mosquitoes around, so you must exclude malaria as well, as malaria can also cause itching. Onto the frontmost grave, you can see a large Sarcoptes scabiei. This bug is here to remind you of scabies. And to the left side of this big grave, you're going to see a lot of mushrooms. Well, these mushrooms are actually fungi, and they are here to tell you about the fungal infection. Now, these fungal infections include Tinea capitis, Tinea favosa, Tinea corporis, Tinea cruris, Tinea unguineum, Tinea barbari, Tinea manum, Tinea pedis, Tinea imbricate, Tinea fasciae, and Tinea gladiatorum. Must keep all these fungi in the back of your mind. Whoa, 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 what else do we have here? We have here is a pangolin. Now, this pangolin is a very scaly animal. It's full of scales, and it's going to represent these scaling skin diseases. For example, seborrheic dermatitis, atopic eczema, lichen planus, and ichthyosis. In addition to that, if you concentrate on the graveyard, concentrate with the really focus, you're going to see one of the graves is just glowing red. What do you think it could be? Well, I think it's some sort of infection or inflammation or something like that. Well, it's folliculitis. So if there is a patient with itch and visible skin lesion, must keep folliculitis, eczema, and fungal infections in the back of your mind. Now, these all were the causes of itch with a visible skin lesion. And just to remind that includes allergic reaction, for example, urticaria, contact dermatitis, insect bite, and it also includes frostbite, prickly heat, sunburn, malaria, and scabies, pinworms, folliculitis, eczemas, fungal infections, and scaling skin diseases. Now let's move to the other side where there's itch without any visible skin rash. I mean to say there's an itch that is secondary to systemic diseases. So in that scenario comes first of all the senile pruritus, also known as steatosis. And we're going to represent this senile pruritus by this old man who has just come to visit her, late gone wife. Next, we're going to give this old man a thyroid bow that is going to tell you about hypothyroidism. And in the hypothyroidism, you also get itch. Now, this old man is sitting under a tree that suspiciously looks like the biliary tree. So must look for the biliary obstruction because biliary obstruction can also lead to itch. Well, in all cases where you suspect obstructive jaundice, must ask about jaundice and clay colored stools, and this can really give you a clue about the region of the itch. Also, we get itch in the chronic renal failure, which is represented by this injured kidney. And to be honest, pruritus can also be the presenting complaint of a patient suffering from CKD. So if you think that itching is because of renal failure, must ask about pallor, breathlessness, metallic taste, nausea, vomiting, oliguria, or polyuria, or just head over to our GU section. Then we're going to draw a jar of candies that's going to represent diabetes. In the diabetes, we can also have itch, tingling and numbness and burning in hands and feet. If you suspect so, ask about polyuria, polydipsia, change in vision, previous history of MI or CVA or peripheral arterial disease, or just ask about the neuropathy symptoms, nephropathy symptoms, or retinopathy symptoms. This is surely going to support your diagnosis as diabetes mellitus. Next, if you just look at one of those graves very carefully, I mean to say very carefully, you're going to see that there's strange pattern on the grave, just like four dots. And you know what? To your surprise, these four dots just resemble the parathyroid gland. So in hyperparathyroidism, you also get the itch. What else can we find in this graveyard? Well, we can always find a lot of pinworms and hookworms. These worms are going to tell you about intestinal parasites, and these intestinal parasites can also give you itch. Or if there are no parasites, but you still get the delusion of parasites under the skin, that's parasitophobia. And this is sufficient to give you itch. Now, if you look at the Reaper, you're going to learn that he's fond of collecting different keychains. One of the keychains is just like crab. The second keychain is a smiley face, and the third keychain is an archer. So these keychains are there to remind you of malignancy, a cancer sign for malignancy, a smiley face for carcinoid syndrome, and an archer for lymphoma, for example, Hodgkin's lymphoma. So in all these diseases, you're going to get itch, but without skin lesion. Now, if we add more detailing to the Reaper, we'll come to know that he is wearing a beautiful necklace. Bro, that's for girls, okay? So ask your patient about lymphadenopathy. And that's seen in Hodgkin disease and other lymphomas, and it's strongly associated with itch. Next, we draw a scarecrow with jaundice. I bet if you're a keen observer, you'll find that this jaundiced scarecrow just lacks the elastic bandages on his chest. So it means it's only jaundiced without any chest pain. So if your patient gives history of jaundice with clay-colored stools, well, in that case, the itch is because of obstructive jaundice. Next, we see, whoa, there are rubies everywhere. It's raining, and these are rubies. Is this magical graveyard or something? What kind of sorcery is this? I don't know, but if you know, just let me know as well. Anyway, back to our lecture, and these rubies are there to tell you about polycythemia rubra vera, in which there's an itching after taking hot baths. We draw a pod. It's the same pod from the Prince of All Saints. It's back. He has come again for more. So when you see a pod, just forget about Vegeta and start thinking about PND, orthopnea, and dyspnea. In simple words, pod stands for dyspnea. So now just imagine there's a patient who complains of attacks of sneezing, watery discharge from the nose, and that is with breathlessness, wheeze, and itch. And this is going to be atopic asthma. To learn more about POD, follow our cardiology and respiratory combined system. Now, this really completes all the causes of itching that are secondary to systemic disease, and this is itch without a visible skin rash. Now, just as a refresher, they all include senile pruritus, biliary obstruction, chronic renal failure, hypothyroidism, diabetes mellitus, hyperparathyroidism, malignancies, for example, Hodgkin's lymphoma, carcinoid syndrome, and intestinal parasites, for example, pinworm, hookworm, drug reactions, polycythemia rubra vera, and bronchial asthma. Next up, you're going to talk about nails, and the nails get deformed or tightened in scleroderma or Raynaud's phenomena. But that's really a clinical diagnosis. Right now, we're just focusing on the history. And what about the clinical examination? Well, that's a topic for another day. Then we give this Reaper some hair. Ah, oh my god, she has been the girl all the time, and I was thinking her to be a boy all the time. Oh my god, give me a break. Well, now that you have seen her hair, just keep in mind that you're also going to take the history about hair, hair loss, hair fall, baldness, and so on. So, after that, now to turn this graveyard into something more creepy, we just draw some lumpy pumpkins around. And these pumpkins are going to tell you about lump. So you're also going to ask about lump. Now, there are just some stupid questions about lump, like how did you notice it first time? What were you doing first time? How did you come to know about that? And just like these random questions, are there many other lumps as well? Now, Then you're going to ask if it's painful or painless. Then you're going to assess the features of the tissues around the lump and so on and so on. Well, the examination of lump really belongs to the category of surgery. It's not just topic for the medicine. And finally, you're going to ask about some pigs, pigmentations. So these pigs are there to remind you of pigmentation. And to add more detail to this reaper, we just come to know that her raincoat was torn, and so we stitched it up for her. Now, what we really did was patching. We just patched her raincoat. So you must ask about any patch on the skin. And finally, to sum up this whole discussion, we give this reaper a rash. Must ask about the rash. And now this really concludes our discussion on the dermatology section. So just to revise all these symptoms, we're going to ask the patient about rash, itch, patch, nails, hair, lump, and pigmentation. And woohoo! Our dermatology is done.